Hi, I'm Dr. Ritakshi, and in this video I will tell you a few ways that you could use to control your blood pressure without medication. Blood pressure is the force exerted by circulating the blood against the walls of the arteries. So if the blood pressure is high, the force or the pressure of the blood against the walls is constantly high. High blood pressure is also known as hypertension. Normal ranges of blood pressure, as you all know, is 120/80, and then there is a category called elevated blood pressure. There are 3 stages of hypertension: stage 1, stage 2, and hypertensive crisis. Hypertension is the leading cause of premature death worldwide, so it's necessary to monitor our blood pressure regularly. Blood pressure that is uncontrolled could lead to complications such as heart attack, stroke, kidney failure, heart failure, and even sudden death. If you have been diagnosed with high blood pressure, it's normal for you to look for ways to bring down the numbers. Lifestyle plays an important role in treating blood pressure. So if you can successfully control your blood pressure with a healthy lifestyle, then you can avoid or reduce taking any medication. Lifestyle modifications are the standard first-line treatment of hypertension. Let's go through 7 ways how we can control or prevent hypertension. First is regular exercise and maintaining a healthy weight. If you're overweight, then your body has to work harder to pump the blood throughout. So losing weight will lower your blood pressure. Exercise can also help lower the blood pressure. Everybody, including those who are diagnosed with hypertension, must engage in 150 minutes of moderate intensity exercise per week or 75 minutes of high intensity exercise per week. We should exercise at least 5 days a week. This could include swimming, cycling, jogging, and walking. We should also aim to include strength training at least 2 times a week. Be consistent when it comes to exercising, because when you stop doing your exercise, chances are that the blood pressure will increase again. Second is quit smoking. Smoking increases the blood pressure. Even after we finish smoking, our blood pressure is elevated for a longer duration. Quitting smoking will help you go back to your normal blood pressure. Also, quitting smoking will help you reduce your risk of heart diseases and other diseases as well. Next is limit alcohol. We should always drink in moderation. So alcohol can be good or bad for us depending on how much we drink. When we consume alcohol in moderation, like 1 glass per day, which could be 4 ounces of wine or 1 to 1.5 ounces of liquor, depending on which liquor it is, it can help lower our blood pressure and can also protect our heart. But this protective effect of alcohol is usually lost when we consume too much of alcohol. Then this counter effects and it increases our blood pressure. So always make sure to drink in moderation. Fourth is eating a healthy diet. We should all eat a diet that is rich in fruits, vegetables, whole grains, low-fat dairy products, and less fat. You can also follow a DASH diet, known as Dietary Approach to Stop Hypertension. This usually is under supervision of your doctor. Consume foods that are rich in potassium. Potassium helps lower the effects of sodium on blood pressure. So blood pressure is usually due to sodium retention, and potassium helps us flush out the excess sodium in our body. Fifth is reduce sodium in your diet. So normally people without hypertension are recommended to consume around 2.3 grams of sodium per day, which is about 1 teaspoon. But people who are diagnosed with hypertension should consume less than 1.5 grams of sodium per day. Always read the food label. The food label would always tell you how much sodium each food contains. This is how you can keep a track of how much sodium you're consuming per day. Next is use less of processed food, because most of the sodium is added during the processing of it. We should opt for canned food or frozen foods, or just have natural. Now, it takes time to get used to not eating salt in your food because your food would taste bland, but you can always use the help of herbs and spices to add flavor to it. Reducing your sodium will help you lower blood pressure by a margin. Next is reduce stress. Chronic stress may contribute to higher blood pressure. Avoiding or managing the stress can really help us lower our blood pressure. So we should identify the stressors and what triggers our stress levels, and we should try and manage them. Now we can also find some ways to relax ourselves to relieve stress. These could include meditation, practicing yoga, or taking warm baths. Always make time for your hobbies or indulge in activities that make you happy and are creative. Always, always, always make sure that you practice gratitude. Avoid using wrong ways to cope up with your stress, such as binge eating on unhealthy foods, smoking, or consuming alcohol. These will just give you temporary effects. The seventh and the last step is to monitor your blood pressure and see your doctor regularly. Home monitoring is the best way to monitor your blood pressure levels. Also, it helps you keep a check if the lifestyle changes you're making are working or not. Additionally, regularly measuring your blood pressure will keep you and your doctor alert for any of the potential complications that can occur. Hypertension or high blood pressure is also known as a silent killer. Most people are usually unaware that they are diagnosed with hypertension, as it may not really have any warning signs or symptoms. So, it's essential that we check our blood pressure levels regularly. In some cases, medication would be advisable for patients with hypertension. This is due to usually other health conditions or complications that they have. If you or someone you know has hypertension, share this video and make these lifestyle changes to control your blood pressure levels. These modifications of lifestyle can also help you prevent hypertension. So, these were some of the lifestyle modifications that you could do to manage or to prevent hypertension. Don't forget to share this video and like this video, and to subscribe to my channel for more information and more videos like this. Thank you for joining in. See you.